Croesawu pawb I briefio eino. Welcome everybody to tonight's briefing. Before we begin, I'd like to provide a brief technical introduction. We're using Microsoft Teams today, as well as broadcasting via Facebook Live. And this means that not only can you watch the meeting, but you can also take part. So if you're using Microsoft Teams live event, then on your screen you should see a tab with a question mark on it. And this will normally be in the top right-hand side of your screen. And if you click on this, it gives you the opportunity to ask questions. And we'll be able to pose these questions to Carol Shillabeer at the end of tonight's briefing. Now, please accept our apologies. We may not be able to answer all of the questions during today's meeting, but we'll continue to update our website with the latest news about COVID-19 and our wider plans for health services in Powys. If you're using Microsoft Teams, it also offers you the opportunity to see live subtitles of today's proceedings. So you should see a button which allows you to switch those subtitles on. And we've got subtitles available in Cymraeg and English, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. And today's meeting is being recorded. Now, don't worry, that doesn't include any information about you in the audience. It's just the people and the information that you see on the screen tonight. That's all that will be visible. And that does mean that people who are not able to join us this evening will still be able to watch today's briefing. So thank you for joining, and our briefing will now begin.
Prynawn da pawb, Carol Shillabeer ydw I. Good evening, good afternoon, good evening everyone. I'm Carol Shillabeer and I'm the Chief Executive of Powys Teaching Health Board, and I'm delighted to be here with you again in what is now a regular series of briefings and questions and answers. So as always, very happy to take a range of questions as we move through the briefing. It always helps me to understand what it is that you're most interested in and the information that you're keen to understand. So please do feel free to put any comments and questions forward. The briefing this time covers COVID-19 in the same way that we've covered this at each of the previous briefings. But this time we're going to just focus a little bit more on essential healthcare services and recovery and renewal. So I hope to be able to give you a bit more information about those aspects as we move through the briefing today. So I'm going to start really with the COVID-19 briefing, and on the slide that is about to come onto your screen will be really the current status of the country of Wales in terms of the levels. So just earlier today, the First Minister has announced that we are now moving fully to alert level 1 from the 17th of July. There are a number of areas where we now have fewer restrictions, and moving towards that place that we may remember was a bit more like normal. But you know, I would just want to say, and I'm absolutely sure everyone is aware of this, but just for certainty here, that we are now in the midst of the third wave. And so on the right hand side of this slide, you will see that just over the last 7 days, and this was up to today, 209 new cases of COVID-19 have been reported in Powys. That's a huge increase on where we were 4 weeks ago and 4 weeks before that. And that means we're now at a case rate of 157 per 100,000 of the population. And that is very high for us here in Powys, and we're actually above the national average at this stage. Some of this is connected to our proximity to the border in England, and our colleagues in North Wales have seen exactly the same. And so the northwest of England particularly has had a higher case rate, and the mobility of the population across the borders there has impacted on the numbers here. I can give you just a little bit more detail on this case rate. So when I say about the border, really we're talking about literally border towns, but also Newtown, and Newtown is one of the higher areas of incidence of COVID cases at the moment. What we are pleased with so far is that our higher risk areas such as care homes do not seem to have widespread problems. So I know I'm going to come on to the vaccine elements shortly, but that is very good news. So at the moment we're seeing the younger age groups actually predominantly having the virus. But I would like to just caution that there are people over 60 who are getting the virus. We know vaccines are not infallible. And so I just want to be open and mindful about the incidences are increasing across the board, although primarily in the younger age group. So that's where we are now. And I think at the last briefing, I said that the Delta variant was the predominant strain, and that is still the case here. Really important to have tests. So our testing service, our tracing and protection service is extremely busy, but is there to support members of the public in accessing the most appropriate test for them. So you can see that we've got the walk-in test centres, and LFDs are lateral flow devices. So they're the self-tests at home, and PCR are the tests that are then taken to the laboratory. So plenty of places to get tested. The next slide really helps us to think about the vaccine programme, and I'm really pleased again to be able to report to you that our progress has continued at a pace. We have already done 107,000 plus first doses of the vaccine, and 90,000 plus on second doses. So, you know, we're not far off having administered nearly 200,000 doses. And again, this is carrying on week in, week out. Everyone now over the age of 18 should have had a first dose, and everyone over the age of 18 should have either had a second dose or be booked in the next couple of weeks. So we believe that we will have offered the vaccine to both doses to everyone by the end of the first week of August. And that is some 7 weeks before we thought we would do that. So we were aiming for September. That was the target date, but we've been able to push forward and bring those second doses forward as well. So please do, can I ask everyone who is listening, watching, to encourage anyone who has yet to have either their first dose or their second dose. There are people who have not yet come for their second dose, and I can't stress enough how important that is to try to tackle this Delta variant. So really important. A couple more stats for me to share with you on the next slide, and for those of you who tune in regularly, you will remember that I like this slide very much, because particularly at the bottom bar, that tells us all of the groups, the categories of the population. We started at the top with residents of older adult care homes. That seems like ages ago, but you know, that was only really the start of this calendar year. And we worked through then care home workers, people over the age of 80, health and care workers, people over the age of 75, then 70, people who are clinically extremely vulnerable. So that was all in the first cohort. And you can see that what we're trying to achieve here is so that the green is the first dose, the blue is the second, and we want the blue to push the green out of the way, and we want all of these bars to be blue. So you can see that the progress is fantastic. We've got a lot of blue on that bottom graph, and you'll be able to see that the groups towards the bottom, particularly the groups aged 40 to 49, 30 to 39, and then 18 to 29, Those people in those groups are currently going through the vaccination of the second dose. So that blue bar will keep moving across, but only if people come for that second dose. So again, important message from me, please do come for the second dose. It gives you the maximum protection against this virus. And I know it's a virus that can still be pretty nasty, so even when you're in the younger age group, so please do encourage people. So in overall terms, 94% of the total adult population have now had their first dose and 83% have had their second dose. It's absolutely phenomenal. And the people of Powys should be so proud of what you've all achieved in trying to protect yourselves, your families, your communities. So it is absolutely brilliant. But we want to go further. We really want to push that second dose right up to where that first dose is. So it would be phenomenal to get to that 95% of all adult population having had the vaccine. Watch out, because when we get there, I'll be trying to push for the next stage. But look, it really does work. Thank you to everyone who's come forward for their vaccine and to everyone who's participated in making the vaccines available. So, you know, I've often said a huge thanks to volunteers, to the military, to the local authority, of course, to people in the health board and to people in primary care. So thank you to you all, and to Mid and West Fire and Rescue. I would just say that we've had our firefighter colleagues supporting us as well. So brilliant. Okay, I'm going to move us now to the next slide, which just gives a little bit of an indication of, well, how does Powys compare to others? So we do continue to have the highest vaccination rates in Wales, both for first and second doses, and we're being able to make more progress than the colleagues in England, and I know there's a big push everywhere. So whilst we always say this isn't a competition, it's a competition against the virus, we're really pleased that we've been able to respond so well across Powys, and that we're really pushing ahead. So just a footnote here, because you'll get different cuts of the information here. So the latest available health board comparison data is the 4th of July. And the BBC's charts show vaccine rates per total resident population rather than eligible. Okay, so we know a lot of people like to follow the detail of the data. So if that's you, we recognise there's some differences in how things are counted and presented. But the UK as a whole doing really, really well, and Wales doing well in particular. So the next slide just gives me a chance to put a bit of a pitch really for what's coming. And we've had some interim guidance from JCVI. For those of you who've been following this, you'll know that that's the Joint Committee on Vaccination and Immunisation. They issued some advice a couple of weeks ago on an interim basis, and they're saying prepare for an autumn-winter booster campaign. Which we have been preparing for, and we're really keen to get started. We will start in September, so long as the JCVI final guidance says, yep, go. And at the first stage, we will be focusing on offering that booster to people who are aged 16 and over who are immunocompromised. So and people who are in contact, so often people who are in receipt of cancer treatment, for example, will be in that group. People again who are living in residential homes, in care homes, very, very important ahead of the winter to make sure they're as protected as they can possibly be. All adults over 70, people who are over 16 who are clinically extremely vulnerable, and frontline health and care workers. So that's stage one. and we'll be pushing on that quite quickly. The good news about the booster is that it doesn't have to be absolutely timed in the way that it has previously been. So I'm hoping that that gives us a little bit more flexibility about how we deliver this. And we are told that there is a good supply of vaccine coming through, so we should be able to push on. And just to say as well, because I think people will be thinking about the flu vaccine, and so the JCVI have given some commentary on that. They've said where it's possible, it's fine to have both together. What we don't want to do is to hold up one or t'other because the other one hasn't come through. So we will look to where it is possible, administer both together, but that may not be possible for everyone. And we certainly don't want to hold up either of those campaigns. They're both very important. And certainly the people I've spoken to say to me, they don't mind. They're happy to go for a COVID vac and then a flu vac after, or vice versa, so long as we're all as protected as we can be for the season ahead. Then stage 2 will be really the adults aged 50 and over. Those who are contacts of people who are immunocompromised or suppressed is the language they use, and people who are in the influenza or COVID at-risk groups. So that's the second stage, and we will be looking to progress that as swiftly as we can once we've cleared through stage 1. And we'd be really pleased to do that and get that going. The next slide just tells a little bit by way of reminder, really, of the things that we need to keep thinking about. So one of the things for me really is considering where we are now. We're in the middle of the 3rd wave, and we're thinking about winter and what's coming ahead. So I think the slide might have got stuck, so I shall keep talking while it comes across. And I guess there's just a general request, really, that as restrictions are being eased, and as I think more responsibility is moving from government's hands in terms of legislation to the general public's hands, I would ask that we just keep going with the general precautions wherever we possibly can. And again, I've spoken to family and friends who say, well, I want to be wearing my mask when I go out, you know, and people will feel perhaps a little bit more confident in having that, particularly as services sort of open up a little bit more these days. But can I just request again that if you do know people who have yet to have their vaccine, either first dose or second dose, please do encourage them to come forward. We will be moving on to the booster doses very soon. And we want to just make sure that anyone who has perhaps thought again about a first or a second dose, to please come forward. It really does make a big difference. The other couple of things that I did just want to touch on at this stage really relate to the longer term prospects, and people may be asking, well, will this be an annual injection as we go forward? And at this stage, we don't know the detail of that, but we're working on the basis that it will, and hence, you know, the sense that this is a booster campaign, and as we move then into next year, we will be certainly working towards what the latest guidance would be at that time about any sort of annual cycle of vaccinations. So if you're thinking about the longer term, that's what may well happen, and of course we'll let you know how it goes through these briefings. So there we are. The slides have changed over. That's very helpful. I'm going to just check I've mentioned everything that I needed to. So everyone over 18, the booster programme, and leaving no one behind. Now is the time to come forward. So please do, if you haven't had your vaccine yet, and speak to friends and family to give them that nudge. And there is priority access for people as well. Check our website because it has much more detail. And then, of course, it's the summer. So summer's returned this week. It's lovely and sunny and warm, and great to meet up with friends and family outside. And so we would still encourage the fresh air, hands, face, space. If you can, please do, because it really does help. So I'm going to move on then to the next part of the presentation, and that's about our plan. And it's been a really difficult environment which to plan. Normally, as a health board, we start working on our 3-year plan, which is required by Welsh Government. So we start that sort of September time, really, is start thinking about that. This year it's been really difficult because, of course, we're having a challenge around the level of uncertainty that we've got about the virus, the pandemic path, etc. So this is a third wave, and many of us thought once we got the first wave out the way, that would be it. But that was the first wave. You've had the second. This is the third. And you know, vaccines are making a big difference, but I think people are starting to talk much more at this stage about living with the virus. There's a couple of things I wanted to impress upon people really in terms of the challenges that there are at the moment. What we're finding is that people are accessing urgent and emergency care in much higher numbers than they were even before the pandemic. So our winter pressures, which everyone sort of knows about in terms of the seasonal challenges, every year we have those in winter. We've got them now in the summer. So our ambulance services pressed, our district general hospitals are pressed, our primary care services pressed, and that's that urgent and emergency. And it may well be that there are people who have been a bit reluctant to come forward or held back for lots of very obvious and understandable reasons, but now accessing care. And so it is really, really busy, which is why we're a bit concerned about levels of incidence of COVID and numbers of COVID cases, and how that might translate into admissions into hospital, and hopefully far fewer deaths, of course, because the vaccine is helping that, but still it adds to the pressure. We're also finding that workforce, our colleagues are self-isolating. I've spoken to 2 people just in the last 24 hours, both of whom have had a contact with somebody who's tested positive, who are now self-isolating. And we are finding that more and more in the health service, but again, across other sectors as well. And we know we're very, very conscious that children are spending quite a bit of time self-isolating as well. So there are these other impacts that are coming through from the case incidence increasing. And then finally, the real challenge about catching up on the work that we weren't doing as much of during the pandemic waves. Excuse me. Got a tickle in my throat. And that is worrying us, whether that be people who are waiting for their operations or their outpatient appointments or other procedures, or people who've been reluctant to come forward with symptoms that they're not sure about. We really do want to support people with their care needs there, but we're finding this a bit of a challenge, to say the least. So I'm going to share with you a little bit more now in terms of the annual plan, and how we are going to try to deal with all of those things that are happening at the same time. So move just to the next slide, if that's okay. Now this just tries to outline to anyone who's watching the steps we've taken to really think about the plan and about what we need to do this year. We took some time to think about what we've learned through the pandemic, what's happened, what's changed, what might have worked well, what may not have worked well at all. and using that learning, thinking about the how we might take that forward. We've looked to understand the latest evidence really about the impact of the pandemic, and we really do appreciate that, you know, when I was talking about really waiting lists and how challenging they've been in terms of trying to provide the care that we would normally provide, that has been really, really challenging. And you know, but at least we can see it. Some of the other impacts have been much harder to see. Mental health impacts, for example, particularly in children and young people, or the impact on long-term conditions, on people with diabetes, etc., etc. And we've also looked to assess what we call assess the position. So what have we been able to do during the pandemic and what haven't we been able to do? Fortunately, we've been able to keep very many of our services open. We've had to deliver them in a different way, but they've been open. But we know that there is a challenge around access, and we're not able to see the numbers of people that we would have been able to see previously. We've taken all of that information and identified some critical priorities and outcomes. And of course, the government has set some of those just at the end of the last term in their paper looking forward, COVID-19 recovery. But these are the ones that really relate to Powys specifically and match across to what the government has published. We've been developing proposals and we formulated an annual plan, and it says the final due at the end of June on this slide, and just to say that we reached that, and we have submitted our plan to the government, and it is available, the whole thing, on our website in our board papers, but I'm just pulling out the key points for you tonight. The next slide really helps to try and capture really what drives us as an organisation, and there are about 10,000 contributions back in 2016, 2017 from the people of Powys to developing our health and care strategy called A Healthy Caring Powys. And these 6 things came through as the things that were most important. So I'm just going to go through them. The first thing is do what matters to people. So focusing on the things that matter most. And often it isn't about having an operation. It may well be that it's about being able to spend time with grandchildren or spend time gardening and those sorts of things. And so we listen to people about how do we square off what matters most to people in their lives. And well-being in itself is getting a much bigger part in the health service now. So it's not all about illness, it's about well-being. Do what works. So don't do things that don't work. Just, you know, use the evidence and the feedback from people about what works and follow that. Be prudent. Now, this is one where people might think, oh, that's all about the money, but what it really is about is using our resources wisely. Now, we know that we're short on some resources, particularly in terms of some staff groups. So we need to use our doctors' time, our nurses' time, our therapists' time really carefully to help on the things that only they can do. Focus on the greatest need. We know that the pandemic has really illuminated that people who are more economically and socially disadvantaged have been hit the hardest by this pandemic, and often they need more support than other people who may be in less deprived circumstances, less economically challenged circumstances. So really focusing on the greatest need. Offer fair access, and we know that access to services is really challenging in rural counties such as ours. But how do we provide that access in a different way? And I just want to share with you one quick story, and some people may have experienced this service, but our respiratory team developed a drive-through what's called drive-through spirometry service. So that is a lung test that we wanted to be able to keep doing for people during the pandemic. We struggled to do it in a building because it's an aerosol generated procedure and a higher risk one. So it was done in people's cars, and it was absolutely fantastic. People got their service, very happy with that. And we took the waiting times down to virtually 0. Brilliant. We wouldn't necessarily have thought of that before, but we can do different things now to offer people access to services, and more people are saying to us, we want services in our own home or close to home. And I'm going to come back to that shortly. And then finally is really working with communities, with people on their strengths. And there are so many strengths here in Powys: community support, community infrastructure. I've never worked in a place like it, and with such a strong third sector as well, voluntary sector, really fantastic. So we're there to support that work. The next slide really helps to, I think, pull it all together. So I've just talked about, on the left-hand side, the principles, talked a bit about the strategy, health and care strategy. And so this is our plan on a page. These are the things that we're going to do this year. We're going to keep going on the COVID response, and there's 2 elements of that. There's the test, trace and protect service, which is really, really important. And then the vaccination programme, which is continuing, as we've talked about. There's essential healthcare. So really on us all trying to focus on well-being and prevention. What can we do ourselves to prevent ourselves becoming unwell? How do we just, walk a little more if we can, drink a little less if we like a glass of wine or a beer, check in on our eating habits, etc. Just trying to do our best to keep ourselves healthy. Primary and community care, accessing support when we need it. And, the NHS is open. It's being delivered in a different way. And we know that that isn't always as easy for everyone as we would want it to be. But please do access the care when you think you need it, and we'll support you to find the right place. And then obviously the secondary care, the hospitals around our borders, that is going to be really challenging during the winter period because we have the flu and we have all our usual seasonal issues, and we're more likely to have this ongoing rates of COVID as well. But then I just want to talk to you about renewal a little, and that's about how do we recover and renew for the period going forward. And we've got 9 key areas. There's 6 there, but there's 4 within the tackling the big 4, and I'm going to show you a little bit about that. Just before I do, all of this is underpinned by workforce, digital, our environment, our buildings and our outdoor space, and then this whole partnership working. Powys is about partnerships, and that all of that will enable us to achieve more than we can achieve on our own. So my final slide really is about renewal, and I just wanted to spend a couple of minutes sharing with you some of the work we're doing at the moment in terms of recovery and renewal. This work really focuses on frailty and the community model. And what this actually means is being able to provide more care in people's own homes. We know from the feedback that we've had that people prefer to have care where they live. They don't want to go to hospital. They want to be in their own homes, and we're trying our best to change our services to support people in that wish. So we've got a service called Discharge to recover and assess. So if you do have to go to hospital, we look to try and get you home as quickly as we possibly can, because your recovery is shown to be better at home in the majority of cases. So less reliance on hospital or care home care, supportive end-of-life care, either in or close to home, and then using our hospitals differently, using them perhaps for more sort of outpatient work or more group work, more therapy work. So, having that flexibility around when we become a little bit more frail, how we get the best outcomes and experience. Long-term conditions is about helping people to manage their own long-term conditions, to stay as healthy as possible for as long as possible, but with the help is there when it's needed, and supporting people to live healthily with their conditions and taking those positive actions, and importantly supporting people with long COVID on their journey to recovery. Diagnostics, ambulatory and planned care is about more diagnostic services in Powys. Now this is a long-term plan ambition for us, but it would mean more day cases, more treatments in Powys, more surgery in Powys, low complexity. We won't be doing heart transplants in Powys, but we do cataract operations at the moment, and we're getting great feedback on those types of services being closer to home. Finding new ways of helping people who are waiting a long time on waiting lists, because it's been interrupted by COVID, both in and out of the county. That takes me to a new service that we're looking to establish very soon, called Advice, Support and Rehabilitation. And this is to support people who may be on waiting lists with alternative services and their preparation for their treatment. So if you're due to have a hip operation, and it would be a better outcome if you could lose just a little bit of weight, how might we help you with that? How might we help you to be as pain-free as possible with your hip condition, for example, while you're waiting for that surgery to come along? I mentioned children and young people a little bit earlier. I think there's a whole range of issues, and our children and young people have had a really tough time. Things have been so disrupted. So it's very important for us to put our energy and our effort into the active catch-up of support for children and young people, helping them now to accelerate their own recovery, and getting them back to ideally where they would have been before the pandemic, or perhaps even further. Children are pretty resilient, but their short lives have been turned upside down. And then finally, we talk about the big four. So that's cancer, mental health, respiratory conditions and circulatory conditions. And it's the same across these: more care closer to home, improved access to support, quick support, including digital care where that's helpful, but also linking with the community and the wellbeing service provision. And I mentioned how fantastic the voluntary sector or third sector is in Powys. So working really closely, because the things that make a difference to our well-being are often in our communities and in our community networks, and not always in the health service. So we have to work together with others. So that's been a rapid run through, and I hope that's been helpful. It does mean that we've got some time for questions, which I'd be delighted to take. And of course, as Adrian said at the beginning, if we don't manage to get all of your questions, please accept our apologies. But please feel free to have a rummage around our website. There's all sorts of really interesting things on there as well. So hopefully you'll get a chance to have a look and find more information about what the Health Board is doing at the moment with its partners. So Giacomo Val, thank you very much for listening, and I'll hand over to you, Adrian, for questions.
Thank you very much, Carol, and for that overview, both of the response to COVID-19 and also for the wider issues of recovery and renewal for the Health Board. So as normal, we've had some great questions coming in through our different channels today. One or two of those questions that have come in, I've been able to respond direct to via a direct message, so that people have got an immediate response from us and a link to where they can find out more. In terms of some of the other questions that we've had coming in, I mean, just how big is the waiting list in Powys? Oh, I've got you on mute still there, sorry.
No, my apologies. So, look, I think the most straightforward answer is it's the highest that it's ever been in my now 11 years, 12 years soon in Powys. And I'm really worried about it. Our two biggest specialties for waiting is orthopedics. So people with hips, joint issues, bad knees, bad shoulders, at At this stage, orthopedics is our biggest, and then ophthalmology, eye care. Both of those types of conditions can really affect people, which is why we're so concerned about this. What I would say is Welsh Government has awarded us £2.5 million as a starting place to try to make some progress on bringing in new services and additional support to treat people from Powys, whether that's in Powys or also linked actually to our other colleagues. So other health boards have had money as well to support them. So if you're a person who lives in Powys, but you're having your care and treatment from another organisation in Wales, money has gone to those health boards and trusts for you and for people from Powys. So at the moment, we have people waiting over a year for services. About 1 in 8 of the Powys population is on a waiting list somewhere. Now that is, we're really pushing quite hard on that. But if I can just share a couple of the practical challenges with you. Where we used to be able to say, see 10 people in an outpatient clinic, because of the social distancing and all the infection measures, we may only be able to see 7. So to get the same number of people seen, we're having to put on more and more and more clinics because of those arrangements. And it is really challenging at the moment to find the workforce, and we've got some shortages right the way across the health service in the UK, and we're finding that quite challenging to bring more people. These aren't people that we can get hold of overnight. And that's why we're looking to support people in a different way often, with alternative support services, advice and guidance. But we are committed to working our way through so that we can move from that position of 1 in 8 people waiting on a waiting list. But it is going to take us some years. We're also finding that the numbers of people coming through the waiting lists are increasing now as well. So it is a challenge to keep up at this stage, Adrian. I'm always an optimist, and although this is extremely hard, we will be doing our absolute utmost across the health board to support people to get their care and treatment as quickly as possible.
Thank you, Carol. I guess there I might express a personal interest, as last week I was somebody who came off a waiting list as I was in hospital having an operation myself. So the operations are happening, and for planned care operations, but it was really clear to me personally some of those challenges of social distancing and infection control and how they were impacting on the operating environment, the extra steps that they needed to put in place through the pre-operative process, the social distancing within the day surgery environment and the post-operative environment. All of those measures were a clear sign of how difficult it is to see the numbers that we might normally expect to see. But I'm sure I'd echo a lot of other patients who are still able to receive those services and are receiving services. Mine immense gratitude to the whole surgical team, to the whole hospital team for everything that they're doing in such challenging times. I think that's a useful segue into the next question. You talked earlier about the rising number of COVID cases. So are we seeing some of that hospital recovery under threat? Are we starting to see wards and ITUs filling up again?
So that's a great question, and thank you for your reflections as well. As a patient, from time to time we all become a patient, so thanks Adrian. But in terms of the surgery being under threat, if you like, again, I have to be very straight and say that we will be doing our absolute utmost for that not to be affected. We are seeing increases in hospitalizations of people with coronavirus. We're largely seeing that in the younger people or people who are in the sort of older age groups who have not had a vaccine, and remembering that the vaccine is not 100% effective. And if I just give a sense that I was told on Monday there were about 160 people with COVID in or suspected COVID in Welsh hospitals. About a month ago, we were under 40 on that. So you can see the difference. And as this wave now keeps growing and growing, we will see more people coming into hospital. That plus the urgent and emergency activity coming through that is not COVID related, plus staff absences, plus the need to keep pushing on with planned care, does make this a very difficult situation. And I can't say with any real certainty that we'll be able to balance all of those things as we go through. What I do know is that the NHS is extremely resilient, and we will find as many ways as we can to keep it going for as long as we possibly can. And we will, if we have to step down a service temporarily, do that for the shortest time that we can and get that re-established very, very quickly. I think how we go now over the next few months and into the winter is really important. And I would like to just say to anyone who is listening to this, to do all that you can to stay well and to prepare for winter. So I'm ready for my flu vac. I'm in the over 50 age group. I'm ready for my my booster, COVID booster. And I'm going to do all I can to keep myself as healthy as possible so that I don't need the services and that other people who do need them more than me will be able to access them. And that's just my ask across the system. But we can keep people in touch as well, Adrian, as we always have tried to do with these briefings periodically now as we move through the rest of the year.
Thanks. And again, that's been a really nice sitter into my next question about the winter, because obviously here we are, weather's nice, it's quite sunny at the moment, it's warm, but naturally for many of us, particularly in the NHS, our thoughts start to turn to the coming winter. We'll have another winter with COVID. We'll have a winter with the backlog of issues that we've been facing. Also, we're probably expecting much more impact from things like flu and DNV, maybe because many of us haven't had the same contact with each other as we would have for a normal winter. So how is the NHS planning for the winter this year? How do you see it panning out?
Yeah, well, all those things are really, really important. You're absolutely right. We've probably not got the immunity that we would have had we not been sort of locked down largely for the last sort of 18 months or so. Well, that's where we will have been by the time autumn comes along. So I would love to be proved wrong, but I think winter's going to be very bumpy. And that's really because we do come together. We have that wonderful sort of festivity in this country. We have Christmas. Not everyone celebrates that, of course, but it's a time where people do come together. The weather as such brings us closer together indoors. And that is also a great sort of petri dish for sharing our germs with each other. And we do have the usual seasonal respiratory conditions. So they are the big things that we are very vigilant about. In terms of planning, can I just say something really, that the health service is one thing, but social care is another. One of the areas that a colleague said to me earlier is about the challenges in social care and how we really do need to work together, the health service and social care, to get ready for winter, because people may need more care at home and we'll need to be able to provide that swiftly. We also want to ensure that our primary care colleagues, our GPs, our pharmacists, high street pharmacists, often underrated, they are a fantastic source of help and advice, but also optometrists and dentists can all provide that really local care and support so that people don't have to always think I need to go to an A&E department or a minor injuries unit as well. But we are working now, and we will be working over the next couple of months on getting the best plan we can for coping with the winter. And I hope that then when we've seen off the winter, that we'll be in a position again where vaccination has happened, where the better weather comes, and that we gradually move our way out of the pandemic, which I hope enables us to just push on more and more with that planned care, those operations, those appointments, and all the things that we've wanted to try to get at over recent months.
And that's really important about the operations and those types of services. Clearly, COVID has continued to have a really massive impact on mental and emotional health as well. So what do you see as some of the real priorities in those areas over the coming months for the Health Board, but also for the wider public service system as well? Because clearly it's not just an NHS responsibility. There are really critical determinants of good mental health and well-being, aren't there?
I'm so glad you've asked me about mental health, because this is my my area that I've got a specific role on mental health here in Wales. We all have emotional and mental health. 1 in 4 of us has a mental health condition at some time during their life, but we all have, like we have physical health, we have mental health, and many of us have had that emotional well-being really tested during this period. So we are hearing more and more about how challenged we've all felt, how lost from and separated from our loved ones that we have we felt, and sort of slightly more disconnected perhaps from the life we knew before. That can take a toll. Some people have had financial challenges, relationship challenges as a result. So people's plates have been very full. It's really important for us at the NHS, working with social care, but also with the police, with the voluntary sector, to be able to support people, particularly with those emotional health issues. They're often very normal reactions to stressors that we have. So if you're feeling a bit low, not quite yourself, it may not be a mental ill health issue, but an emotional health issue, and is often a normal reaction that we can feel better about when we get some advice and support. And that I just want to put a plug for something called Silver Cloud. It is something that we developed here in Powys that is now available across Wales, and it is an internet-based, it's called Cognitive Behavioural Therapy, CBT, but it helps us with our thinking, and that in itself helps us to cope with and manage some of those emotions that we feel. The other things that are very practical and hopefully doable for many people is to get fresh air, is to get some exercise, is to connect with other people, have conversations, have a chat in the park, etc. Those things really do make a difference to how we feel about ourselves and feel about our life. But I'd also say there are a huge number of supportive organisations, whether that's Mind, whether that's Citizens Advice. They can help on all sorts of things, financial advice, relationship advice. So there is help out there, and we will endeavour to make sure that people accessing our own website will be able to be directed more and more to these areas that can help. We are also increasing the range of services for those who do need help, because there is a mental health matter. We have seen increases in people with an eating disorder challenge, for example, and we're looking to support more people with those sort of situations. So this is a big one, Adrian, and I think we'll be looking to come back to that. We had a presentation, it may still be available on the website, a couple of meetings ago, a couple of briefings ago, a really fantastic presentation from Louisa Kerr from our mental health service, really sharing the efforts that are being made in this area. But please do access our website, because there's a lot more information that you'll be able to find through there.
Thank you, Carol. And for those accessing today's meeting through Teams live event, I've just posted the link to SilverCloud there as well. And coincidentally, we've had some posts via our social media channels about SilverCloud today too. So if people follow us on Twitter or Facebook, then there's more information about how you can access SilverCloud. What I'll also do after the session is add some links to our previous briefing sessions so that people can follow those if they weren't able to watch them at the time. You talked then about the partnership working that was really important for mental health. Again, that leads into the next question is how do you think those partnerships have been affected by COVID? And in particular, what do you see as the next steps for supporting the important voluntary sector in POIS?
Yeah, a fantastic question. Thank you very much for asking that. The first thing to say is that the partnership working has been phenomenal during the pandemic. The ability of people to come together in a crisis against a common aim, with a common aim in mind, it's been brilliant. I just want to pay tribute to the voluntary sector and to Powys County Council, but also to the police, the fire and rescue service, and other community groups, of which there are far too many for me to pull out, because everyone stepped forward during the pandemic. Now, I do know that some of the things that we had hoped to be able to achieve before the pandemic have had to be sort of put to one side a little bit. But as we move forward, it underlines a couple of really important things for me in the partnership of working. One is that we have an important role to play together on helping people who are in situations where they need more help and support. So be they the socially, economically more disadvantaged communities, where income levels may be lower, job employment may not be as certain, and even things like a roof over somebody's head. I think there's been a real appetite amongst the partners to really work hard on those really important things, the things that really matter. So I was delighted to be part of a public service board meeting a couple of weeks ago where all the services come together in Powys, and we talked about how we come together to support people who find themselves in difficult circumstances. There's a wealth of ideas and thoughts based on real life experiences of people that we can all do to look out for our neighbours and our communities. So I think partnership working is very much alive. We've got some really important things we want to get done. So the North Powys Wellbeing Programme, for example, really key development in North Powys, and the potential to develop a new site in Newtown. Very keen that we look to make some progress on that. But we're trying to manage both the current situation and plan for the future. But I think the motivation and enthusiasm is stronger than ever to be able to push forward on these things, Adrian. So thank you for that question.
Thank you. Now, conscious of the time, we're coming to the end of tonight's session, and to me that feels like a perfect point to be able to end the session with that real vote of thanks for the partnership of all the people of Powys, all of the organisations within Powys for how they've responded to the pandemic so far and for the work ahead. I mean, the people of Powys have been truly amazing. My own personal thanks have been down at the Mass Vaccination Centre in Builth Wells today, and the strength of the volunteering support that we've been seeing has been truly amazing. So now, Carol, just an opportunity to make any final remarks before we close tonight's session.
Well, I think the first thing to say is just to underline and echo what you've said. So fantastic efforts. And I think at times it's when we're walking and climbing a mountain, which no doubt this pandemic is, you just look at the climb you've got ahead of you. Sometimes you need to just stop, turn and look at how far we've come. We've come a very long way in Powys in managing this pandemic together. And so I do want to reiterate my thanks, and for us to just take a little bit of time, hopefully rest, have a little holiday if we're able to do so that we can regroup now and move on to the next stage together. So yes, diolch yn fawr iawn. Thank you so much to everyone who's been part of this this endeavour. I know that we'll look back. I was chatting to a friend about this the other day, a fellow nurse. I trained with her, and we were reflecting on how quickly our careers have been going, because in our heads we were 18 again, and we said, oh, we'll look back, we'll be able to tell our grandchildren all about the pandemic of 2020 and what happened and how people came together. So although it's still, you know, pretty tough, we will be able to get through this. So a huge thanks to everyone, and I look forward to catching up with people again. So diolch yn fawr iawn. Thank you, Adrian, as well, for supporting this session.